welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor as well as mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And today I have the honor and privilege of interviewing my colleague here in Hoboken, Maria McNish, and we focus on the topic of picky eating and difficulty transitioning to solid foods. And what's really special is that Maria and I really share a passion for working on the whole body of a child and optimizing nervous system function. And we do it a little bit differently with the tools of her using OT and speech therapy and my tools of chiropractic and craniopathy. But they all work so beautifully together to help support normal function for a child. So Maria McNish is the founder and director of Advanced Therapy of America. She's a certified speech-language pathologist with over 20 years of experience and enjoys speaking at local, national, and international conferences. Maria is a myofunctional therapist trained by the IAOM and is a certified autism spectrum disorder clinical specialist. She's the creator of OccuSpeech, a dynamic treatment approach that provides speech and feeding therapy in the context of movement and sensory-enriched environments. Maria is also the co-author of a chapter on swallowing management. She has specialized training in numerous oral motor and feeding interventions, including talk tools, oral placement therapy, and SOS approach to feeding. So today we focused on picky eating and difficulty transitioning to solid foods. And she's passionate about teaching and empowering parents, leaving listeners with a new perspective and a desire to search for specificity and the root cause of any symptoms. And she's at the Advanced Therapy of America website as well as on social media. Hi, Maria. Welcome to the show. I'm very excited to have you on today.
Hello. Thank you so much for having me. I'm equally excited.
So this is going to be a fun topic and an important topic. I realized I haven't had a speech language therapist on my show in a while. And we've talked a little bit in the past in other episodes about picky eating, more from a nutritional perspective, but this is different. This is really more of a sensory thing. And so you as a speech and feeding therapist have a lot of expertise around supporting children in having normal feeding. Yeah, which is so important. So let's start off with just speaking about why you chose to become a speech language pathologist, and you've been doing this work for over 20 years, and kind of the whole journey of how you've gotten into this feeding therapy specialty. And I also am really excited for you to share about OccuSpeech.
Oh, thank you. Absolutely. Yeah, so I knew I wanted to be a speech pathologist, believe it or not, at the age of 8. My brother, when he was younger, had some speech difficulties. And like many, siblings, I was that sibling who would go to with him to therapy. And, my mom and I would do his homework, and something just resonated with me. And I started to see the progress he was making and said, wow, I would love to actually do this for a living one day. So I always want to tell all of the siblings who have, people in their family with special needs, take it as an opportunity to perhaps shape your life one day and your future one day. And I can tell you, I have a team of 28 therapists. All of them got into this field because of a personal experience that they had in their lives. And so what got me into speech pathology initially, again, was my sibling, who is now a fully functioning, sergeant in the military, police officer, doing beautifully. And what I ended up doing was took classes very early in high school, knowing that I always wanted to get into the medical field, and became a speech pathologist at kind of record speed.
Wow.
Yeah. So I really got into feeding though. My background was at Kessler Institute for Rehabilitation. So I was blessed to work on one of the most dynamic and amazing feeding and swallowing teams in the entire country for 8 years.
Oh, wow.
And
this was mostly adults, or was it children?
It was all adults, actually. But But my experience at Kessler taught me that you need to look at the root cause of things. Instrumentation is very important. And the biggest piece of feeding and swallowing is that you have to understand the effect that it has on the family, specifically the parents, because we know that feeding is one of the most important things that we do each and every day. And the psychosocial effects on a family dynamic when feeding is at stake is so big, and really what got me to be so passionate about not just helping the individual with the feeding or swallowing disorder, but the entire family in the process.
Yeah, that makes a lot of sense because food is one way that we show love, and certainly it's a big part of social connection. Eating out, for example, or making a meal for your family. There's a lot of love and connection that's communicated right through that process, even though we also have to eat to live and survive. So I could see why if there's a challenge in that area, it's, yes, primarily it's like, yes, you have to get nutrients and sustainment and food and fuel in your body. But what about all the other things that come with eating?
Absolutely. So it's that social connection. It's that ability to go to a party and know that there'll be something that your child will be able to eat. It's the ability to get on an airplane and not worry, oh my goodness, if I have a long flight, my child's not going to eat anything that the airplane provides. So it actually can have such a huge effect on the opportunities that kids have in their lives if picky eating is a part of their profile. And so when I left Kessler and founded Advanced Therapy of America, my goal was always to take that medical mindset to a pediatric clinic and continue to have the opportunity to do really innovative work, knowing so much about the brain to really understand that when a parent is feeling like picky eating is an issue, you have to keep peeling that onion until you find the answer. And unfortunately, so many parents are sent from one doctor to the next. Everything's fine, everything's fine, everything's fine, but it's not fine. And that parent feels exhausted and they feel like they can't connect. And at the end of the day, we ask these parents, how do you feel after eating? And they say, I feel frustrated and sad. And we want parents to enjoy these beautiful opportunities that they have with their young children. So what I ended up doing with Advanced Therapy of America is really train my team that if a parent comes in with any of those feelings of emotional sadness after being around the table, that's enough to work with them. Whereas I think other programs would say, no, you have to have aspiration or reflux or constipation or penetration. Not for us. We're treating the whole child. And we know, again, that psychosocial domain of all of this is very, very important in addition to all the medical aspects behind feeding and swallowing.
So can picky eating ever be just like a behavior like, oh, I only want to eat candy and sugar and like an entitlement type of thing? And then also, like, how can parents tell, like, is there an actual underlying medical issue here that does need to be addressed as opposed to discipline and, that type of reaction to a picky eater?
Absolutely. So there are certain medical variables that will have very clear-cut signs. For example, reflux. So reflux is actually, in my opinion, very often overly diagnosed. So you will go to your pediatrician, you'll go to your doctor, and they'll say, oh, you're having trouble feeding and swallowing? Okay, try this reflux medication. So people are very quick to recommend reflux meds, but that's not always the answer.
I find it typically isn't the answer, actually.
Exactly.
It doesn't mean your child's not spitting up after feeding. And we're talking about infants here, right? So they're bottle or breastfeeding. But that's not addressing the root cause. The medications are meant to suppress stomach acid, and this child is not making too much stomach acid the majority of the time. That is not the issue. And you're setting your child up for some potential future digestive issues as they get older because their stomach is not making enough acid to digest food and absorb.
Precisely. Absolutely. So all these kiddos out there that are on these reflux meds, of course, there's other medical variables. So there could be delayed gastric emptying, there could be constipation, there could be food allergies. But what I really want to talk to all of you about today is when all of those tests come back okay, what is still happening with this child's nervous system that their nervous system is saying, no, I'm not comfortable with transitioning to solid food. And those are those kiddos that the parents come in and they say, I'm trying everything and I just can't get them to eat. They won't open their mouth. They're pushing everything away. They're crying. And so getting back to your question about behavior, I am a true believer that behavior, especially when you're talking about a 6-month-old. So
right. An infant.
Yeah. I mean, they want to explore. A typical infant, there's that interest in food. You give them a spoon, they want to bring it to their mouth. They have this natural innate instinct to be ready, and their body is telling them they're ready. But when your sensory system is telling your brain that you are not ready, these behaviors come very, very quickly. So in speaking with the sensory system, we're talking a lot about this reflexive brain, this brain stem, what essentially is telling your cortical brain, you're okay. This is not a threat. And so a lot of kiddos who have picky eating, it's bigger than that. These are also the kiddos that are often colic, again, what does that really mean? Or these are often infants that require a lot of movement to be settled. These are infants that you see the mom needs to do or the dad needs to do a lot of melodies to get their systems to calm. And then you go and put them in a feeding situation and all of their senses are overstimulated. So I have to touch it and feel it and taste it and smell it. But my nervous system is not ready for this huge sensory overload. And that's where we see so many behaviors start coming in at a very, very early age.
Yeah, so that's interesting. So I should preface, because you're saying kiddos, but we're really talking about an under age 1 child here.
Yes.
And ideally around 6, 7, 8 months, something like that, where they've been on either breast milk or formula. And now, it's their 6-month birthday. It's like, oh, they read the manual. It's time to start giving them solids. No, not everyone's ready for solid foods at 6 months. And sometimes, there's even a push at 4 or 5 months, which could typically, be too early, right? But, if a child is 7 or 8 months and we're looking for signs that they're ready to start solids. So part of that is also they're able to hold their body up on their own, right? So if there's a special needs child with core weakness and hypotonia, that could also delay them starting solids.
Absolutely. The body, the stronger core and the more control that you have over your neck and your head is going to make it so much easier for you. So many muscles are required to actually initiate a swallow, and so many of the cranial nerves are involved. And if one of those muscle groups is just not working accordingly, it's a lot of work. And so you have to look at the full body, which is why anytime we assess infants, our gold standard is to work with everyone on the team. This is not just, again, speech pathology. I always say the neck up, not anymore. It's full body speech pathology at this point. So what is going on with their bodies that is giving us so much information as to whether or not these muscle groups are ready to tackle feeding, which is the most complex motor skill that they have to develop at this age.
Wow. Yeah. Even more so than rolling or crawling.
Yeah. 26 muscles and 6 cranial nerves to initiate a swallow. I mean, think about that. It's fascinating.
And you know what else is fascinating? You're speaking to a pediatric chiropractor and craniopath who specifically address cranial nerve function, spinal nerve function based off the alignment of the skull and the spinal column. And what we'll see, maybe this would be a good question for you. If there's a child that doesn't have any overt special need diagnoses, but is still having challenges, for me, I would look at their pregnancy and birth history and potentially even birth trauma And were they delivered via vacuum? Was it a long labor? Was there medications involved? All of these could certainly create misalignments in their skull and or spine, especially the neck area. And that could be creating stress on their nervous system and therefore making it more challenging. And those would be, in my opinion, the easier cases to address, because that's something that with some chiropractic, we can have their nervous systems working normally and then they're able to do what they need to do, right? As opposed to maybe a genetic diagnosis or something like that.
Yes, for sure. And I think one of the beautiful things that you do as well is the information that you're giving to parents and empowering them to have all of this guidance in so many different areas. I mean, you're impacting so many lives. So I always talk about also giving your child experiences to develop those motor skills. These container babies that are going from one place to the next and being carried everywhere, the importance of tummy time cannot be underestimated. And so you're getting their bodies in alignment, ready to go. And then it's also that parent having the ability to work those muscles and incorporate those muscles into the activities that they're doing with their children, each and every day.
Right. So yeah, less time swaddled and in a car seat. Car seats really are only for the car only to keep the child safe while the car is moving. But the rest of their day as an infant they need to be able to move arms, legs, roll, all those things, because that will impact their milestones. And, even I've had examples told to me about babies that are, swaddled in the SNU, let's say. So they're completely restricted with not being able to move for sleep time, nap time, every time that they're asleep. And they're very delayed in milestones because they're not getting enough time to actually develop and use their muscles and, create the curve in their neck and all the things that infants need to do. So if those types of milestones are delayed, we could see how that would also delay feeding.
Absolutely. Because feeding, one of the big things with feeding is there are very complex motor movements that children need to learn. And I always say to the families in general terms, big muscles, then little muscles. So the muscles that are required to manage solid foods, there's so much. It's just an intricate process, but also requires dissociation. So dissociation is when a child can move one muscle independent of the other. And so if you don't have good head control, how could you possibly ask a child to lateralize their tongue or move their tongue left and right while they're trying to manage a solid food? Everything is kind of moving together as one cohesive unit. And so the beauty of dissociation comes from motor planning, teaching these muscles how to work, but also having the muscles have the strength that is needed in order to really advance the feeding from that infantile suck and swallow to actually being able to manipulate food, move the food left and right and to the back to get that swallow initiated. And so, yeah, I think again, we're just so lucky to have all of us together in one amazing place where we can, hit every single area. And I just think it's just such a unique opportunity.
So you also bring up a good point. We've had talks on the other podcast guests come on talking about tethered oral tissues and certainly how it impacts feeding in regards to a bottle or breastfeeding, right? But let's talk about how it impacts now an older infant who's wanting to start solids and also starting to use maybe a couple words, right? And their speech component. So can you speak to that point as well and talk about that?
Absolutely. So my interest in tongue and lip tie, again, came from my desire to constantly look for the root cause of things. And I would love to give you some very easy take-home strategies that all of you can do today to check to see if a tongue or lip tie may be present and what the effect would be on feeding and swallowing. And so for an infant, you actually can do a sleep test for an infant. When your child is sleeping, you can very softly go over to your child, open the jaw very, very softly, and see where the tongue is resting. ideally, you want your tongue resting on the roof of your mouth. A lot of infants with tethered oral tissues, you see the opposite. The tongue is resting on the floor of the mouth. And I can't even tell you the amount of skills that are needed when your tongue is not resting in the right place. It affects your breathing. And so we know the importance of nasal breathing. So we want everyone breathing through their nose with their lips closed. If your infant is consistently breathing with their mouth open and their tongue is resting on the floor of the mouth, sometimes the tongue may even be protruding past the lips. That is very often a definitive sign that the tongue is not able to rest where it wants to. And also, the tongue resting at the roof of the mouth provides the infant with a sense of safety. We don't realize that the mouth it is such a modulator. It is a regulator. And so when an infant has their tongue resting in the roof of their mouth, it's actually giving their body a sense of safety and calming, which is why I always say to my parents, if you're having a stressed day and you want to go eat a whole chocolate cake, it's because the mouth is an organizing place for a body, and it's the same for an infant. So a lot of these infants will start sucking, you'll see some thumb sucking, you'll see some
pacifier
use, extensive pacifier use. I always say to parents, I understand you need the passy, but if your child is in a very good place, there's no reason why you have to have that pacifier in there all the time. And
especially after the age of 6 months.
Absolutely. I see all the time in Hoboken, I literally have to stop myself from stopping. Parents just, these kids are in beautiful places. They're just loving the world at all different ages. I see 2 and 3-year-olds being pushed, in strollers with passies in their mouth, and they're in a very good, happy place exploring the world. So it's not needed, at that time to provide that oral sensory soothing. But yes, in terms of some of the speech issues that you'll start to see is very similar to what happens with the tongue protruding past the mouth or past the teeth. The only sound that the tongue should be sticking out in our English language is the TH sound. So if your child is, obviously this is the older group that we're speaking to at the moment, but if your child is making sounds like S and Z and T and D and L and N, where their tongue is actually coming out of the mouth, that is something that definitely requires further exploration to see, is there a tethered oral tissue that's not allowing the mouth to move in the way that we want it to? And then also with feeding, we see a lot of issues with children not wanting to transition to solids, or kids who prefer solids that dissolve, so require very little motor complexity. And a lot of these kids, and again, we're also talking about the older group here, but they will often put food on their molars because their tongue can't deliver the food to where it needs to go. So they're genius. I mean, you have these 1-year-old kids who know my tongue can't do the work, so I'm going to make my fingers do the work. And my fingers are going to actually place the food where I need the food to go because I don't feel comfortable and safe when my tongue can't manipulate the solid that's being introduced.
Right. So in a case like that, where certainly function's impacted and potentially there's all these other issues that could develop for that child as they get older, you would recommend having the ties revised.
So what we do is, best practice with ties is that there has to be a functional deficit tied to that tongue or lip or buccal tie. And so what I always recommend is what we like to do is functional assessments and really see, is feeding affected? And that's across the lifespan. Is the child having difficulty transitioning to those, solid foods around the 6-month time frame, as you mentioned? But it kind of, again, we have people, believe it or not, we have people 18, 20 years old coming to our clinic that say, oh my goodness, my whole life, I had no idea that I had a tethered oral tissue, but because medicine is advancing so much, and they actually get it remediated in their adult lives. And so it's just fascinating that if you can catch it early, of course, that's best practice. But this is something that we're seeing across the ages at this point.
Right. And so for an older child or even an adult, it can still be beneficial to release those ties And then, the best practice I recommend, whether it's an infant or an older child or an adult, is also to get the pre and post frenectomy body work to really address all of the other oral soft tissue structures and alignment around where those ties developed, because there's going to be fascial adhesions. The TMJ or upper neck could be out of alignment, the cranial bones. So we want to get everything in place to optimize the best results from cutting those tethered oral tissues.
So fascinating, story. When I decided to branch out and further my career to go from speech-language pathology to myofunctional therapy, Sandra Holtzman is my mentor and someone who I love dearly. In her class, there were about 20 adults that were taking the class that actually said, "Oh my goodness, I think I have tethered oral tissues." And I identified myself as a mouth breather. Never thought about it before. So I actually have an overbite and an overjet because I was a mouth breather. And 4 years ago, actually retrained myself to no longer be a mouth breather. And so my personal experience in all of this helps me to help families to realize this can be across the ages, but it's something that, again, for new moms and new dads, if they're looking at it in a much earlier time frame of development, it would be so much better, because now I literally have to go for orthodontics at the age of 46, if you can believe that or not, because now I've retrained myself to no longer be a mouth breather, and now I have to go for orthodontics. So there's so many cosmetic aspects of this, feeding aspects, breathing aspects, as well as speech aspects. So it's just so multifaceted.
It really is. And I also found out as an adult that I had a tongue tie, and I had it revised at the age of 35, probably not as fully as I would have liked. And but back to your whole thing of, I was an open mouth breather my whole life and didn't think much about it, but had, my tonsils removed because of that breathing, and other airway allergy type prone things because I wasn't filtering the air through my nose like I'm supposed to. So all of these types of things are linked to the tongue tie and airway, especially while I'm sleeping, right? So I had to train myself to keep my tongue against the roof of my mouth as well. And it can be done. I mean, certainly you have to be, this is not for, you can't teach a baby this, but you can, as an older child or an adult, really consciously make an effort to do that. And, I even have my dentist say, you know what, you do that, you practice taping your mouth closed while you sleep. And this will literally, you can teach yourself, assuming you don't have a blockage in your nose that is not allowing you to breathe through it. But for me, it was just more of a narrow palate because my tongue was not resting and forming the palate to a nice wide part as a child when my skull was, at its most development. And just thinking that it was normal to sleep with my mouth open. I even had a friend once, I was on a road trip in the passenger seat like this, and I'm fast asleep, and he took a picture of it because it looked hilarious, right? Like an old man. And I was like, oh, I thought everyone, slept with their mouth open because that was my normal.
Can you believe it? I know, after all this time, but I think our personal experiences help us to help our patients and explain that there's no time limit to this, but how excited are we now that there's so many professionals embracing this so that it is identified at a much earlier time?
It's optimal to identify it and address it as an infant, honestly. That would be the best time to address this. The brain is doubling in size that first year. So, also supporting all the cranial structures to optimize that brain development and, learning how to use all the motor and everything that you're talking about. We don't want to compensate. You had mentioned putting, we can always find a way around things, but it's not the optimal way. And then once we create these habits and patterns, years and years, it can make it more challenging to correct them. It's much easier to do it with an infant. Like you just, they don't have to learn these bad habits.
Precisely. And this is where I think we have to tell moms and dads, and especially those new moms, when you are, feeding your child and looking at the latching, the tongue moving back and forth to sucking and swallowing well, these are usually those initial red flags. And so many of those parents will end up discontinuing breastfeeding and going to the bottle, and they get by. But what happens is it creeps up again when in that that 6-month stage, when now we need that tongue to start working. We need the lips to start closing. We need the lips to start rounding. And the parents almost feel like they're reliving what happened when they were initially going through all those difficulties when their child wasn't able, to latch. So my feeling is if there's an issue there, we have to find the answer. There is something happening.
There's something going on. And,
something.
And I would say back to the whole new mom thing, moms who are really struggling to breastfeed and they're not getting the support they need will, they will give it up because it can be so hard. It can be so painful, so exhausting. And if you don't have a team supporting you, then, it's not sustainable. But the challenge, if you go to the average pediatrician, is they're not getting also support, resources, referrals. This is not a pediatrician's expertise, but in an ideal world, they would be saying, okay, you need to see the chiropractor, you need to see the feeding therapist, you need to, see the lactation consultant, all the things to the dentist to revise those ties. So I find that the average pediatrician doesn't know a lot about this. And so it's more like, okay, well, it's like about the compensation instead of like the actual identifying and treating root cause.
Precisely.
That goes back to the meds you were mentioning, the reflux meds.
Yeah. And ear, nose, and throat specialists. I mean, they can be so important in the identification. I always say before I start teaching younger children to do nasal versus mouth breathing, I want an ENT to assess and make sure there's no blockages. But I can't tell you how many times, it's really very important for us to work with our ENTs and work with our pediatricians. And of course, we're working together and the beautiful team that we've devised in Hoboken, all of these amazing minds coming together. But yes, it's at no one's fault for not knowing. But it's one of those things I guess I've learned over 22 years. If I don't know, I will refer to someone who does.
Yeah.
And that's the bigger piece, is not saying it's okay. Because I think once they hear that, it's like the box is checked. And you have to sometimes you have to be a clinical detective. You have to find the answer.
Yeah. So for me, the bottom line here for new moms is trust your gut, trust your maternal instinct. And even if the doctors, and it might be more than one, are telling you everything is fine, it's normal, which is really what they're saying, common, right? But common and normal are not the same word. Keep looking, keep searching until you find someone who can help you find that root cause and address it, because moms know. And, it's really important. And that's my thing with empowering women, especially during pregnancy, because now once you're a mom and you've had that empowered birth experience, you won't take no for an answer. You're not being easily shut down because that there's in your heart, there's something to be discovered here. And it sometimes can take a few practitioners to actually help you get there. But, get support. Moms groups are great. If you're like having something come up and you're like, I know something's not right, and you don't even know who to go to, then you can share, if you're open to sharing your story with other moms. Another mom might say, oh, I had a similar experience with my child, and this practitioner was very helpful. And then it helps connect the dots. Like, oh, I wouldn't think to bring my child to a chiropractor to help them feed, right? But it's like one of those things where now there's other moms like, I did it, it worked. And then it opens up from there, practitioners like you and I that are connected with complementary type healthcare specialties will also be like, okay, we actually want you to consult with this person and have that team approach.
Yes. And get that full picture. And yeah, I agree with you. I think that, I think the power of co-regulation during feeding cannot be underestimated. And so a lot of the secret to my success is the energy that I am providing to this infant. So when you go into a state where you're anxious and nervous, that infant is going to pick that up immediately. And then it affects their sensory systems and their motor systems and their ability to engage. And now you have this vicious cycle, and especially these poor parents who are going in and stressed the minute that it's time for feeding, which is constant throughout the day. That co-regulation piece is so important. And so I actually train new moms to work on their breathing before they even enter the situation. And one of the biggest take homes I want to tell your listeners is there's so many people suffering from anxiety. There's so many people suffering from mental health needs these days. And when I tell you the ability to close your mouth and breathe through your nose is such a huge factor in reducing anxiety attacks, in increasing co-regulation with your child. And so as parents, there's even things that you can do for yourself to give that child the opportunity to open up. Because when you're feeding your child, it should be a moment of pleasure and engagement and connection, not stress and really making, if your heart is beating a mile a minute and there's all this cortisol in your brain telling you that this is a very stressful situation, we need to help you with that. And so, I couldn't agree more. I think that relationship and that bonding that should be a part of feeding is a very special component. And so we want parents to have the ability to do that. And I think we'll all help you to get the answers.
I am so glad you brought that point up, because that's a huge one. And I talk a lot about mama self-care, but I don't actually frequently enough talk about the co-regulation that happens between a parent and their child, because all young children, infants, are not able to regulate their own nervous system. It's immature, it's still developing, and they are absolutely dependent on the caregivers closest to them in their life to help them feel safe. And safety is an absolute requirement for our nervous system to function normally. So that's why in my practice, we see a lot of dyads, meaning mama and baby, because motherhood can be really stressful and really intense, especially for a first-time mom. And it can be overwhelming. And when mom is feeling overwhelmed and exhausted and stressed, that will directly impact her infant's nervous system as well. So it's like, how do we support that mom with being calm and empowered and supported, essentially? And there's a lot of ways to do that. Postpartum doulas are amazing for right after birth to support you. And then, like I mentioned, the other practitioners that can come in and help support. But, a mom getting her chiropractic adjustments are just, the baby is having difficulty feeding. We always say, Mom, you got to get yourself on the appointment too. And it's funny. Sometimes she'll say, oh, once we get this breastfeeding thing figured out, I'll schedule myself. And it's like, well, we don't need to wait for that, because this is directly impacting you and your baby's ability to feed and optimally feed as quickly as possible. So it is very important. And especially those first 9 months of that child's life, the mom is the biggest role in that baby's development.
Yes. And so getting back to what you were saying about some infants not having sensory systems that are available and ready. So when I'm talking to parents, I usually will say that you have these infants that are, again, these quote unquote easy baby. So, I just put them down. They go to sleep. They're just very happy. Anything I introduce, they're open to explore. But you also have these infants who their systems are a bit more on the high arousal side. And what that means is that any of those senses that are being triggered or stimulated, a child who can be highly aroused in one of those senses, whether it's how they're hearing or how they're tasting or how they're feeling. And again, you're absolutely right. The child is in the sensory motor stage of development. So we don't expect all of their senses to be perfectly mature at 6 months, but we want the senses to mature by their ability to adapt to this input. And so I see a lot of parents who are forcing the food, just eat it, just take a bite, just take a bite. How many times do we hear that? Just please open your mouth, just take a bite. At that stage of exploration, we want those kids getting dirty and messy. We want those kids touching the food. The brain, when it comes to the homunculus in the human brain, which is that sensory motor strip, the hands and the mouth are next door to each other in the human brain. And so that hand and mouth connection, allowing your child to get messy, allowing your child to feel the food, that is all a huge part of this. And not putting so much of the pressure on the amount, but look at what they did with that food. Did they explore with a new color or a new taste or a new texture? That's what matters at that stage in the game. And unfortunately, so many kiddos who their senses are in that heightened state. And look, there's tons of adults who have senses in their heightened state. And there's tons of adults who are living with senses in the heightened state, but
and they also have anxiety,
right? And also, the cup gets very full. Your emotions can go from 0 to 60 very quickly.
Tightly wound.
Exactly. Your bucket is easy to overflow, and that's okay, because some of these individuals are some of the most powerful and, amazing people in the world, but they're still in that sense of dysregulation. And we should not be in a dysregulated place unless there is a threat. Our nervous system is meant to protect us. Our vagus nerve is such a huge component of this. And the vagus nerve is triggering whether or not we should fight or flee or be comfortable in the environment. And so kiddos that have sensory systems that need a little bit of help, I think the work that you do and the work that we do in our infant sensory motor program is a beautiful match. Because you're getting them into that just right place so that their bodies can perform these movements. And believe it or not, one of the best ways to get a child more regulated is through proprioceptive and vestibular input, which is movement and muscle work. And so there will be kiddos out there that have those high arousal sensory systems that you might need to get their systems in a better place before you could even do the tongue or lip tie, because pre and post-op is going to be a lot more difficult, and before they're going to be able to move to those solid food journeys with you.
Totally. And I also just wanted to spend a couple minutes talking about OccuSpeech. I think it goes back to your whole body approach, whether it's speaking or feeding, and how the whole body can be involved.
Yeah. So again, speech pathologist, 22 years. The work I do today is all from experiences and some of those, oh, wow, experiences. And so when I founded Advanced Therapy of America, I actually founded it as a speech clinic. There was no occupational therapy at all. And what I was finding was that so many kiddos were coming into the clinic in very dysregulated places. And having been an ABA therapist as my first position in the field of special education, I immediately hired a behaviorist. So that was the first member of my team at ATA. And we tried a lot of behavioral strategies. Again, this gets back to that initial question you had, these behaviors, but where are the behaviors coming from? So we tried a lot of that with feeding as well as speech. And one of my BCBA best friends said, why don't you get an occupational therapist to come in? So lo and behold, I had an occupational therapist come in. We had no equipment at all. We went to Bed Bath & Beyond and bought, when I tell you, pillows, things that would provide this child with a sense of calming. And lo and behold, it changed my entire life and my entire perspective on speech, language, and feeding. Because what I realized is it's not a behavioral issue where a token is going to get them to be able to do this. It's getting their bodies in a regulated state. And so children were producing their first words when I had them on a swing instead of when I had them at a desk in a typical speech environment. Kids were eating foods for the first time when we had them in, we do a lot of crash pads. So they're almost like big mattresses. And we literally have these kids in crash pads and we're squeezing their bodies and we're getting their bodies to feel really calm and nurtured. And boom, now I'm ready to eat. Motor planning, getting the kids to be in the context of a gym where they can work their muscles, especially those big muscles, getting everything prepared for those smaller muscle groups that we're going to need for the active feeding. And so we created OccuSpeech, which is essentially occupational and speech therapy working in the room together. And it has changed my life.
It's amazing.
Absolutely changed my life. Yeah.
And it makes so much sense.
I know. obviously I'm a business owner. I'm a working clinician. But I can tell you, I wish I was a researcher, because what I really need now is to take it to that next level. Because of course we need that evidence-based practice at all times. But what I can say is the combination of all of us working together, what you're doing, occupational therapy, speech therapy, all of these amazing disciplines, when you actually do it in the same place, in the same room, it's that wow factor. So instead of going from one place on a Tuesday, I have occupational therapy on Tuesday. No, let's have occupational therapy while you're actually working on the feeding. And it's made all the difference.
Yeah. And, it's for parents who have special needs children, that is also exhausting to have an appointment every day of the week. And their whole life is just shuttling their child from one place to another. Right. And the other challenge with that is sometimes the practitioners aren't communicating with each other as well. So there's things lost in translation. So, that team approach of people that are communicating and working together is just optimal, especially for those tougher cases.
Yeah. And especially when I think of what parents think of as occupational therapy, it's often thought of as, fine motor work. So sitting at a table, cutting, working on dressing, working on scissors, working on handwriting. Our approach is extremely different. Our approach is actually working on central nervous system regulation and engagement and safety. And when you have that foundation, that's when the senses start to be able to say, okay, I do feel comfortable trying that food and putting it in my mouth. Okay, I do feel comfortable having a crunchy food and hearing what it sounds like as I'm chewing, because my body and my central nervous system is not on that state of alert and it's open to these experiences. And so yeah.
That's amazing. Essentially, what you're saying is those children are stuck in a fight or flight, oversympathetic. And when do we eat? Rest and digest is parasympathetic. So you're helping to teach that child to get into more of a parasympathetic state, and therefore they feel safe. And also that's when the other senses can work.
Absolutely. And what a lot of people don't know is that the vestibular sense, which is that sense of movement, that is what I call the mother of all senses. So when your vestibular system is in a good place, and vestibular can be explained, again, you have your infants where you want to, put them down to go to sleep. Some parents are moving extensively to get the child to be able to calm. Other parents just put the child, right down and the child falls right asleep. That's a sense of your child's need for vestibular movement. All these moms that are bouncing on therapy balls, that's vestibular input. And because parents have such amazing ability to understand what their child needs, they do the movement and then they calm the child. But that vestibular sense is the mothership of all these other senses that are required for eating. So the ability to be able, and speech, so the ability to be able to listen and touch food and interact with food and smell the food and taste the food actually comes from that vestibular system, allowing the brain to make those connections.
Wow, it's so fascinating. Well, Maria, do you have any last thoughts you want to share with the audience?
I just want to thank you for all that you do. I was listening to some of your podcasts, and I just want to say that, again, I've seen your office, I've seen the people that you're working with, but you're affecting so many lives, and it is my absolute pleasure to do things like this and be a part of things like this. I think when you really say that you want a family-oriented practice, when I came into your center, that's exactly what I felt. I felt that it was family-oriented. It was a place where as soon as I walked in, I felt that I was cared for. The environment that you're providing is state of the art, but it's more about the energy and the beautiful, passionate experience that you allow for. And so I think, again, us, being in Hoboken together, it's just amazing that we're both in the same place, because a lot of my colleagues around the country and around the world, they have to really search much, much further to find like-minded professionals. So I want to thank you for your commitment to empowering parents. I am in this journey with you, and I thank you all for your time today.
Oh, thank you so much, Maria. Well, I hope you learned so much from today's conversation I had with the amazing Maria, who really just animates her passion and her quest to learn and do better for her patients in over 22 years of clinical practice. And I really applaud that type of yearning and searching and development. And she says she's not a researcher, but I disagree. She is definitely the detective looking at how she can take the next level approach with helping treat her patients and improve their quality of life, as well as the quality of life for the entire family. So she really is such a gem. If you want to contact her or learn more about her, check out her website at therapyofamerica.com.